Today, we're going to be talking about the consumption. What is the consumption, you ask? Well, there's a very easy answer, but it's not nearly as interesting if we just give the answer away. In truth, consumption went by many names throughout history. The Romans called it tabes, while the Greeks called it phthisis. In the 1700s, people knew it by the name of the White Plague due to the paleness of its victims. Consumption is now more commonly known as tuberculosis, or TB. TB has a long history of changing society. It didn't just change things like medical care and practices, it also influenced fashion, helped push populations west, and influenced literature in parts of the world. The history of TB actually begins long before people realize. It can actually be traced back to the ancient city of Al-Tiyam, which is now underwater in the Mediterranean Sea off the coast of Israel. But the bacteria that causes TB wasn't discovered until 1882 by Dr. Robert Koch. Back then, it killed 1 out of every 7 people. Finding this bacterium was the first and most important step in the battle to get rid of TB. Before this discovery, populations in the New England area believed that TB was hereditary. They believed that the first person in a family to die of TB would come back as a vampire to infect the rest of his family. Now we know that it's actually an airborne bacterium that is spread when someone with TB coughs, sings, or speaks. It wasn't until 7 years after the discovery of the bacteria and a different doctor, Dr. Herman Biggs, that the New York City Department of Health and Hygiene began to report cases of TB. This led to the first ever published report of TB in New York in 1893. In 1953, the CDC published for the first time a data table of all the TB cases in the United States. 84,304. Now, the CDC publishes an annual data table. Historically, treatments for TB included things like bloodletting, rest, good food, and staying warm. Often, if you were living in the cities out east, one recommendation given was to head out west and live in fresher air. Because of this recommendation, the Stetson cowboy hat was made. John B. Stetson, after being diagnosed with TB, was told to move out west for the fresh air. While he was settling into his new surroundings, Stetson became aware of the fact that there was no proper protection from the sun, and thus, he made the Stetson cowboy hat, and incredibly, he survived. Other fashion trends we got out of TB were higher hemlines, and because of higher hemlines, shoes were made visible, and thus had to be made more beautiful. Now, how does TB present itself, and what parts of the body can be affected? TB is most well known for affecting the lungs, but it can also affect other parts of the body like the brain, kidneys, and spine. Classic signs of TB include coughing, chest pain, and coughing up blood, but symptoms vary depending on what part of the body TB is affecting. Some of the more general symptoms of TB are feeling sick or weak, weight loss, fever, and night sweats. Now, if all that wasn't confusing enough, let me add on a bit more. TB isn't always an active illness. You could have a latent TB infection, which essentially means you have the bacteria in your body, but you don't actually get sick because they aren't active. However, that doesn't mean that you won't get sick. Having latent TB means that at some point, it could become active and multiply, destroying tissue in the body and then spreading it to others. Today, we treat TB patients with medications and a DOT, which is a direct observed therapy, where a nurse watches the patients take their medication every day. A nurse can either go to their home every day at the same time and make sure the patients take their medications, or they can arrange an EDOT, an electronic direct observed therapy. Nurses do this to make sure that the patient is compliant with the medication regimen and assesses if the patient is having any issues taking their medication, like having side effects or problems swallowing. The medication should be taken as instructed to kill the Mycobacterium tuberculosis in the patient's system. We want patients to get better for their health and not spread TB to the community or their loved ones. Now, Nebraska specifically has quite a colorful history regarding TB. Kearney had a TB hospital that is now part of the University of Nebraska at Kearney campus. It was known as the Nebraska State Hospital for Tuberculosis, while not even a half-mile away lies the Frank House. This house was home to one of the earliest and richest families in the city. The Franks had the first home in town that had electricity. The family, however, lost the house in the late 1800s, and after the ownership changed a few times, it was sold to the state of Nebraska and became part of the Nebraska State Tuberculosis Hospital, where it became quarters for hospital staff until 1971. The home still stands today and is open to the public as a museum. Though we have better testing, vaccines, and treatments, tuberculosis is still around today. In 2022, 8,300 TB cases were reported in the United States alone. We know now that tuberculosis has been around for centuries, but agencies worldwide are working to end TB. In fact, World Tuberculosis Day is March 24th every year and will remain so until TB has been eradicated.